Jonathan, and this is the 6 p.m. news on Équinoxe Television, live from my headquarters in Cameroon's economic capital, Douala. And our top stories in this edition of the news at a time when there is a global call for a ceasefire in the northwest and southwest regions of the Republic of Cameroon, and for negotiations between government and the separatist leaders to begin. The Army Chief of Staff General Claude Meka sees the global crackdown on separatists launched by the 5th Military Region Commander General Kavala in the northwest region of the country is yielding fruits. He said to the press today that the soldiers are succeeding in their mission to ensure that the two Anglophone regions of the country, hit by socio-political and security tensions of close to 4 years now, is under the control of the state. We'll come back to that in greater details in this newscast. Separatists are not in control of the two Anglophone regions of the Republic of Cameroon. Soldiers are in control of the two regions, says General Claude Meka, Army Chief of Staff. He has been to the northwest and southwest regions of the Republic of Cameroon and says that the soldiers are succeeding in their efforts to ensure that the two Anglophone regions of the country are under state control. He equally said that there is a success on the path of the soldiers fighting to put an end to the separatist activities in the two Anglophone regions. And according to him, the global crackdown on separatists in the two Anglophone regions launched by the 5th Military Region Commander General Kavala is yielding fruits, and he is making the statements at a time when there is a global call for a ceasefire in the two Anglophone regions of the country, and there is global condemnation on the use of military force, which according to civil society and political leaders as well as rights organizations in and out of the country, is contributing to radicalize many more people, thus worsening the situation. Immaculate Fogwe reports.
From Douala through Boyer to Bamenda, Army Chief of Staff General Claude Meka went assessing the security situation of the 2nd and 5th military regions, including the crisis-hit Anglophone Northwest and Southwest regions of Cameroon. Based on situational reports from heads of the 2nd and 5th military regions, he says the soldiers are succeeding in their peace mission in the Northwest and Southwest administrative regions.
Everything is under control.
Concerning the global crackdown on separatists spearheaded by the 5th Military Region Commander General Kavala in the Northwest region, the Army Chief of Staff says
Ça produit des fruits et ça doit produire des fruits.
It is yielding fruits. Though civil society and political leaders condemn the use of military force, which according to them is contributing to radicalize many more people, thus worsening the situation.
Cela nécessitait un certain recadrage.
General Claude Meka urged the soldiers to remain professional in the discharge of their duties.
Some youths in the town of Limbe, southwest region of Cameroon, have taken to the streets protesting against what they qualify as a mafia in the sale of public structures, and they went on a peaceful protest today in the town of Limbe. Pushing further, they handed a memorandum to the senior divisional officer of the FACO division saying no one will be allowed to take over the state structure that is being put on sale by some individuals, considered and which is considered by the young people as a mafia. Davidson Maimo reports.
They are protesting against the occupation for what used to be a preventive center, serving as a small clinic or hospital in the 60s, 70s, 80s, and lately the 90s. then transformed to the office of the District Medical Officer of Limbe Health District after the construction of the PMI, Limbe Integrated Health Center. The youth say the building has been sold off to a private individual with complicity of some persons in high offices.
We are getting an information that that structure has been leased out.
To be precise, sell, not even give, sell. Some unscrupulous administrators. Times are hard. Thanks for understanding.
This pillar in front of the building indicates that the frontage had earlier been sold, probably to another individual. The protest move saw the youth presenting a memorandum to the first assistant senior divisional officer in front of the SDO's office.
We rally ourselves to come to you as a representative of the head of state to give you a memorandum that you will help forward.
The first assistant SDO promised to channel their worries to the appropriate quarters.
Hierarchy is taking good care of it. There is no need for you people to go on the streets, and I'll urge you people to keep your placards so that we will make a detailed report.
The protest of the youth is timely, given that gravel and sand already on the site indicate of construction work to begin soonest. Some pundit, however, question why for more than an hour protesting at the site and marching to the SDO's office, no police officer was spotted at the scene, qualifying it as a staged protest. The occupation of state land in Limbe is not new, as the entire government residential area, GRA, custom quarters and others have been invaded mostly by the well-to-do before the very own eyes of the administration.
And some inhabitants of the Douala 4 municipality are now complaining and lamenting over the houses that are being destroyed as municipal authorities engage in the construction of drainage patterns within that municipality. The construction works, the demolitions started today, and some of the inhabitants crying out to the Yaoundé administration, saying that they have nowhere to go to. Let the Yaoundé administration save them from that difficult situation of homelessness. Smanjikan Gabriel report.
I'm a widow with children that they don't have where to go. They are under me. They are broken me. I don't, as I'm standing here like this is all me. I don't have where to go.
Just like Madame Elizabeth Fokum, who has lived at Forever for more than 15 years, and Bwenchi Allen. These are some of the unfortunate inhabitants who have just seen their residence touched as the Douala 4 officials fight against flood in this part of their municipality. Due to the floods experienced by this zone when it rains heavily, a good number of persons who live along the drainage line have been rendered homeless by the ongoing opening of drainage patterns that were blocked. For those without a plan B, like Madame Elizabeth Fokum, they are begging.
Let them tell us if they broke like this after. We'll even make even one room to stay there. We'll be happy. Or if they are telling us that as they are making like this, we should just go. Because like this, even where to sleep, I don't have where to sleep.
Several of those whose houses have been touched point fingers at the manner in which the Pont de Bois was constructed, reasons why the team of the city council didn't miss out at the bridge, which many blame for the floods because it was poorly constructed.
The newly constructed bridge that is between Kachebileng and Amabanda, this bridge was too low, and because of this bridge the drainage is not going very fine, and I realized that all the experts have come to see him themselves and they've decided to do the drainage. We really appreciate the effort that the government is doing. We want that the sitting council mayor should continue to go right up to the fullest to this job, because this job presently now is the reason this is not too good, but we want it to be done. No matter what, no matter the destruction that will come up, anybody who will be destroyed should be aware fully that he is inside the drainage. and there's no bias. They're doing an objective job.
The reopening of the drainage pathing started at Forever neighborhood, and the team has confronted several challenges.
Nous sommes confrontés avec un peu d'incivisme.
We are confronted with some unruly character which has forced us to do more. But notwithstanding, as we are leaving the most delicate zone, we are going to catch up with time. But our major challenge is the sea level.
La marée. Parce que on ne travaille que lorsque la marée est basse dans cette zone.
The bulldozer that is presently opening the drainage pattern, according to the council officials, has as one objective the fight against flood.
Pour éviter les inondations,
because we don't want flood, we are just opening up the drainage patterns, and we shall come back when it is dry in October.
Sèche, parce que on est obligé de faire ce qu'on fait là en saison de pluie pour bien voir le niveau d'eau.
The exercise carried out by the Douala 4 council officials comes several weeks after a sensitization tour taken by the Lord Mayor of the Douala 4 council, Dr. Mobi Edward.
Highways across the Republic of Cameroon continue recording accidents attributed to the bad state and narrow state of sections of some of the highways, overspeeding, reckless driving, and the bad state of some vehicles, among other risk factors. In the last accident on National Highway number 5, 2 heavy-duty trucks came into a head-on collision. Smanjik and Gabriel once more.
Another brutal accident on our national road network. This is the National Road number 5, precisely at Mojoka, where 2 lorries went on a head-on collision. I picked up a passenger to drop at Mojoka, only for me to meet this head-on collision. I'm surprised that even as the road has been opened, such an accident could still occur. We are shocked and don't know who is wrong.
I'm not sure whether the motorbike for the motorbike be there. I'm not sure whether I don't come out.
At the time of the arrival of the Équinoxe TV crew, none of the occupants of the lorries was present. Gendarmes who visited the accident scene confirmed to us that no one has been seen wounded or dead as a result of the accident. All their search at hospitals have proven futile. They also decried the fact that the documents they found in the 2 lorries that had this collision could not help them in their investigations, as all were fake. This accident, road users have blamed it on the poor state of the roads and say only the government can bring a change.
The accident, because it won't be so now the bad road.
As for me, I think the poor state of the roads is the cause of this accident. Only the government can decide to reconstruct the roads. It's not the work of a citizen. As a result of the accident, circulation of vehicles around this zone was slowed down as the lorries blocked a major part of the road.
The World Health Organization has encouraged medical students of the University of Boya to keep on working hard and moving up the academic and professional ladders despite the difficulties and the threats against the profession. And Dr. Martin Monono KK was speaking in the Boya today. He is the United Nations delegation head. He was the United Nations delegation head to the University of Boya, notably the Faculty of Health Science in that higher institution of learning. Derry Jato files in details on Boya.
At such a time, COVID-19 pandemic is proving wrong scientific research. The United Nations World Health Organization, WHO, visit the University of Boya Faculty of Health Sciences with a message of steadfastness.
And despite the difficulties that society may throw at them, they should be very proud of being able to provide help, solace and succor to those who are in distress.
Cameroon-born Dr. Martin Ekeke Monono, consultant with the World Health Organization, is heading the delegation. In a meeting with these University of Buea medical students, the WHO consultant reminded these doctors in the making that they are the last hope of the society, and despite the challenges, their consciences to save lives must be alive.
They should have 3 judges in all the work they do: their conscience, their patience, and their God.
To Professor Hale Ekane Grigori, Dean of the Faculty of Health Sciences, it is a privilege to have you on campus and a motivation to his students.
No, my impressions can only be good, because it's not every day that you see the World Health Organization in your institution. So for us, it's more of a blessing than just taking
And while hoping for the best, the University of Buea Faculty of Health Sciences is also preparing for the worst.
If we are molding doctors, it means we are taking the leading role in this fight. There is no other way of doing it better than what we are doing. That's building capacities.
The best gift a true partner can offer at this tempting period is COVID-19 preventive kit, and that is exactly what the World Health Organization brought for this Faculty of Health Sciences of the University of Buea.
Late human rights advocate in Cameroon, Dr. Chimuta Divine Banda, who is the president of the National Commission on Human Rights and Freedoms, will be laid to rest on Saturday, July 18, 2020. That is tomorrow, in his native Mfoya Bafut village in the northwest region of the country. The corpse removal took place today in the nation's political capital, Yaoundé. Details with Innocent.
The mortal remains of late chairman of the National Commission on Human Rights and Freedoms, Dr. Chimuta Divine Banda, being removed from the Yaoundé General Hospital morgue Friday, July 17, 2020. This marks his journey to eternity. Corpse of the deceased human rights promoter leaves the mortuary straight to the esplanade of the Ministry of External Relations. From there, a brief stop was made at the headquarters of the National Commission on Human Rights and Freedoms, where some state dignitaries and his collaborators bid him farewell.
Daddy, we want to thank you for the life of our father, a husband, an uncle, a brother. Papa, we know where he is. We believe that he is with you. And that is why we will mourn like those who know you, because we knew his activities on earth there, and we know that he is by your side.
Dr. Chimuta Divine Banda's corpse from here takes the road to Bamenda for his native Mfoya village in Bafut subdivision, Mezam division, where he will be laid to rest this Saturday, July 18th, 2020.
As we move, you prevent us from any accident in the name of Jesus. Papa, you cover us all with the blood of Jesus, so that at the end, we'll give you the glory and the honor.
Upon arrival in Mfoya Bafut, a church service will take place at the Presbyterian Church Bafut, after which there will be a brief stop at the Ahala family residence for final homage.
We will miss him, oh Father, but we know that he is by your side, and for that reason we'll give you the glory.
Dr. Chimuta Divine Banda died 2 months ago, notably on May 18th, 2020 in a private clinic in Yaoundé, after battling with ill health for over 2 weeks. The 74-year-old became chairman of the National Commission on Human Rights and Freedoms in 2003, thus spending 17 years at the helm of this institution, fervently advocating for the respect of human rights in Cameroon. He was member of the Commission of Inquiry that probed the Ngarabo killings of February 14th, 2020. His death came less than a month after the findings of the inquiry ordered by President Paul Biya were made public. Dr. Chamuta Divine Banda was born on December 26, 1946. After graduating from the University of Yaoundé, he proceeded to the Nova University in the United States, where he obtained a PhD in public administration.
That's it for the first part of this newscast. Talking Point is up next. Thank you for staying with us in Talking Point. Today, we are receiving a health entrepreneur, Jean Lope. You're welcome.
Thank you very much. Thank you very much.
All right, we're going to talk about healthcare delivery in Cameroon. What's your take about healthcare delivery? What's your take on healthcare delivery in Cameroon today?
Okay, I think first thing we have to commend the efforts of the Ministry of Health so far. I think we've seen from the example of what's going on with the COVID pandemic we are all facing, the efforts they are making to try and make sure closing some of the gaps we had already in the healthcare delivery aspect of things in Cameroon. And what we are coming to do at this point is to try and provide other alternative solutions to add to the value that they're already bringing to the table. So,
all right, we're going to talk about that alternative solution which you're bringing in as an entrepreneur. But first, when you look at the health services that are delivered to the population today in urban areas, in remote areas, and issues that are being highlighted by the medical experts concerning their training, their equipment, the technical equipment in hospitals. Why is it that till today healthcare delivery in Cameroon is not yet maximized? There are still many parts of Cameroon where healthcare services are not very much available, affordable to the population.
Yeah, I think that's a reality we are facing in Cameroon, and I think most of sub-Saharan Africa faces the same kind of challenges. The first one is mostly around, if you look at the doctor population ratio, it's really not looking good for Africa. Recent statistics say it's about 1 doctor for every 8,000 Africans, meaning we have very few doctors, and those doctors can take care of everyone in Africa. Those ratios could be better. I think what most of the health practitioners are expecting is more support maybe from the government angle of things, and make sure we encourage even younger ones to try as much as possible to aspire to become health practitioners tomorrow. And then why not create possibilities for them to get a good route into getting the proper training and then boosting or making it better, those numbers around doctors population ratio. In terms of facilities and all, I think all the main thing that we'll be expecting is support from mainly the government, which is around making sure that they increase the spend on healthcare. I think the government is seeing that. Hopefully, there's been progress in some previous years. Hopefully, with the COVID-19 situation today, we've seen how they deployed a lot of resources to make things better for every one of us. Hopefully, that will be the trend. Continue to see that improvement around there.
All right, and the alternative, which is coming like a solution to at a time where when many Cameroonians are not very comfortable going to hospitals. They are afraid of contracting COVID-19. Some of them are sick of other diseases that have nothing to do with COVID-19, but they don't want to go to a hospital because they're afraid that going to the hospital, especially the state hospitals and the ones that are handling the COVID-19 cases, they may contract it there.
Yeah, absolutely. That's the fear. It's a global fear. Nobody. This is not the best time for normal individuals to be aspiring to go to the hospital if they have other issues. And basically, that's why Waspito has been is one of the great solutions to this. And the objective is to try as much as possible to limit the population that is in the hospital. Try as much as possible to handle the basic healthcare issues, the kind of issues that when you go to the hospital is just a conversation between you and the doctor. So people like that don't need to go to the hospital. We have to free up space for people who really need the attention now at the hospital. So that's the alternative solution that Waspito brings.
However, the officials of the public hospitals in particular, the Lakantini Hospital, the General Hospital, the Gynecopediatric Hospital, and all the other hospitals, regional hospitals, assuring the population that enough measures, adequate measures have been taken to ensure that if you come to the hospital, you will not be exposed to COVID-19 and so on. But the alternative that we're talking about today is telemedicine.
Yes.
What is it all about?
Okay, telemedicine starts it's a platform where patients can easily, with a few clicks, especially on Waspito, it's just 3 clicks, you can get access to a medical doctor of every specialty. So it means you don't need to leave your home anymore to go to the hospital when you have just basic healthcare needs. So basically what happens is you just go to the Google Play Store, download our app, and then you register. From there, you can just, with a few clicks, search for the doctor that you're looking for, the kind of services you're looking for in terms of specialty, and then you click pay through Orange Money, and then you have access with a video call with a doctor. So that's one side of telemedicine. It's a whole big field of things in the healthcare ecosystem. But the 2 key things we are trying to solve at the moment is consultation, virtual consultations with doctors by video calls, and then the other side is the health community, where people can go online, ask questions to doctors, and get answers in real time. So that's basically how we're trying to bring a helping hand to what the health sector is really doing.
All right, you're running a telemedicine platform. Are Cameroonians streaming in their numbers to be consulted by some of the health experts working with you? Is it really popular? Is it like something that Cameroonians are running after, or they? Yeah,
I think the answer to that is yes, and it would take time. It's a novel product. We've had some other very brilliant people try to do it before. We are just coming with another enhancement, and hopefully we try to make sure we sensitize the population enough. But just to throw in some numbers there, we started on the 12th, and already we have 4,000 people who have downloaded the app. So it's less than a week. 4,000 Cameroonians already on the platform.
Yeah, that's about your platform. I'm talking about telemedicine.
Telemedicine, yeah.
Are Cameroonians really aware of?
Yeah, I mean,
this other alternative.
Yeah, with these numbers I've just thrown in, it gives you an idea of the fact that people were expecting, they were waiting for something like this. With the challenges you highlighted earlier around people having that phobia now to go to the hospital, they've been looking around to see what are the alternatives that can help us still get the care that we need. So relatively, you can say Cameroon is getting towards there. It's still novel. We are trying to push in terms of communication as well. But I think generally Cameroonians, a good number of Cameroonians are aware from the number of interactions you can find on Waspito today. You get a feel of that this is something that people were expecting, but there's still a lot of ground to cover. We can't say for sure that absolutely every Cameroonian today is aware of telemedicine and is expecting telemedicine.
A lot of ground to cover, particularly or probably in the area of internet connection,
absolutely,
internet availability, because there are still many parts of Cameroon today, many good chunk of the population who do not have access to internet, access to Google and whatever. But how effective is it? That's the question. How effective is telemedicine?
Okay, basically where Waspito comes in the level of telemedicine, what we come to bring to the table in terms of solution is to provide that access to doctors, where people can just dial in, call a doctor, you have a consultation. Statistics show that more than half of the consultations we have with doctors are just a conversation between you and the doctor. So the doctor asks you some questions, you answer, does some diagnosis, then requires you to go and do some tests, or then sends you to go to the pharmacy with the other prescription. So all that can be done virtually. You don't need to go to the hospital to do all of that. So it means you have a doctor with a video call in front of you, you ask you those same questions, and then Waspito has a few clicks method of providing the prescription prescription by doctors. When the doctor has finished asking the question, done his diagnosis, maybe he wants you to do some lab tests. He will give you a lab order through Waspito. You go, you use that, go to a lab, do your tests, and then the result will come automatically to the system, notify the doctor immediately as well. Then he will do a prescription for you and send. You can still buy from Waspito the medication. We have someone come deliver to you at your place. So that's the kind of, we want to do the full cycle of care in terms of from consultation to lab tests down to when the delivery of the medication and the follow-up from the doctor after that as well.
Now, the discussion between the patient and the doctor online is not very much different from the discussion, a face-to-face discussion in the hospital. But the question somebody will be listening to you now will be asking, but how efficient? How efficient it is with regards to the consultation, the result of the consultation, and the prescriptions, the medical prescriptions. How efficient is it in terms of solving the problems of the patient?
There are two ways to look at that. The first one is we're using just professional doctors. So these are people who consult normally in the hospitals today. So whatever you're doing online is the same person you would have met during the day in the hospital. So that's the one. The second part is we end at the level of basic healthcare. Now, from the moment you start the consultation with the doctor and the doctor feels like he needs to see you, to feel you, touch, this is the type of pathology that needs to see you physically, we'll shut down that. He will just advise you to go to the nearest hospital. If you're in the same city with the doctor, he will ask you to come physically to the hospital. So we don't intend to handle the full spectrum of pathologies. So it's basic healthcare provision, the kind of pathology that can be managed with just a conversation. And if you try Waspito, you'll see how clear, crispy clean the videos are, meaning the doctor is seeing exactly what he would see physically with you in the hospital. But anything that needs him to touch you, to feel you, to understand the symptoms better, then we'll shut it down at that point, do a reimbursement to the user. The doctor would advise the user to come to the hospital physically or go to the nearest hospital which in the city in which the patient is found.
Waspito is your platform?
Yes, it is.
Now, if somebody is at home now and the person is feeling sick and doesn't want to go to a hospital, wants to go through telemedicine, what is that person expected to do?
Okay, two things. Number one, you just go to Google Play Store, search for Waspito. It will be on the top of the list. Just download Waspito and then register into Waspito and search for doctors. Then you can do with a few clicks, you can call a doctor. All you have to do is make a payment, Orange Money, Visa card, or MTN mobile money, and then within a few seconds, 3 or 4 seconds, you're in a video call with a doctor.
How affordable is it?
At this point, we are at the generalist angle of things. We're doing 5,000 francs, and then on the specialist side, we're doing 8,000 francs.
So what's the difference between the hospital and telemedicine?
Yeah, the thing is,
when you go to the hospital, you still have to pay this.
Absolutely, absolutely. The thing is, what we are trying to do is the convenience. We talked of two things here already. We talked of the fact that you don't need to step out and go out there, stand on the long queues. We have very few doctors, means in the hospitals there's a lot of people there trying to consult. At times you wait 2-3 hours before you talk to a doctor. But Waspito, instantly, you don't need 2 minutes, you're already talking to a doctor. So that's the convenience angle of things. And then the second part of it is anything that Waspito can't handle from that telemedicine situation, we do a reimbursement immediately, and then you have to go to the hospital for the physical examination. So the convenience is mostly what we are selling. It's easy for you to just at any time of the day, even if you wake up late at night, there are doctors that are on guard in Waspito as well, where you just with a few clicks you're talking to a doctor. I mean, it can be important for first aid situations as well. You know, there are times when you'll be looking for a number to call a doctor, but Waspito, you have a good a number of doctors available online all the time that you can easily reach them without having to go through the route of driving out of your house or paying a taxi, go to the hospital, stand in the queue, or go to the hospital and find out the specialist you're looking for is not there. You know, this is speaking even to people who are in certain remote areas where there are no specialists of the specialization that are looking for is not available in the local hospital. They have to travel long distances to go and see this specialist. So Waspito brings the solution in a way that you just stay from wherever you are, you just need internet connection and a smartphone, and then you are talking to the specialist that you're looking for within a few minutes.
And somebody come online just for consultations?
Absolutely.
And then when the prescriptions are made? How is the prescription delivered for the patient to take to the pharmacy or to the...
Yes, it's inside the phone. You have a PDF prescription signed, digitally signed by the doctors. So you can use that and go to the pharmacy, or use the other beautiful route where you can just buy the medication from Waspito. Again, you have it delivered to you at your home. For Douala and Yaoundé for now, we're going to expand beyond these two cities in the nearest future. So that you have your prescription with a click of a button. The doctor sends a prescription that is prepared in the system. It appears on your side as a PDF format. You can choose to send that through. Maybe if you're not the person going to the pharmacy to buy it, you can send through WhatsApp to the person who is going to buy. But it's a clear prescription, PDF document, digitally signed by the doctor and stamped, and then with the Waspito letterhead on top of it.
Is there something else you want to say about telemedicine?
I mean, basically, I would just like to encourage every Cameroonian out there to make sure they subscribe to Waspito. Not only Waspito, every other person out there who's trying to do telemedicine. It's very beautiful. It's very convenient. It's the future. COVID-19 has shown us that we have to go digital in many things, and I would encourage every Cameroonian to come join the digital health community which we are creating there, and as we grow, let's grow together. If we don't do, one very important thing is the beautiful thing about Waspito is done by Cameroonians, or let's say by Africans. It's something that if we don't bring this solution, we don't bring it up ourselves, we'll only wait and watch another person bring it and come and sell it to us here expensively. So please encourage us. Let's see how we can make this happen even better.
Jean Lobe, health entrepreneur, thanks for joining us today.
Thank you very much. Thank you for having me.
Thanks, ladies and gentlemen, for staying with us. That's it for today. Goodbye.